released today shows a sharp spike in opioid-related deaths during the pandemic. The report shows that in Ontario, 695 people died of confirmed or suspected overdoses during the first 3.5 months of the pandemic. That's a jump of almost 40% compared to the same period in 2019. And if that trend continues, Ontario could be on track to see a record 2,200 opioid-related deaths in 2020. Younger people, especially men, are particularly hard hit. To talk more about the study, we're joined by Dr. Tara Gomes from St. Michael's Hospital and the Ontario Drug Policy Research Network. Thank you for joining us. How concerned are you about the findings?
Well, thanks for having me. I'm very concerned. This is something that has been raised since really the pandemic started to take off in mid-March, that the precautions and the public health measures that are required for COVID-19 to stop its spread could have really devastating impacts on communities of people who use drugs. And I think what we're showing in this report is exactly how that has played out.
So how does that play out? Why has the pandemic impacted opioid-related deaths?
There are a lot of reasons. We have seen that the drug supply has become more toxic and more contaminated, and that could be due to border closures and changes in the way in which drugs are being moved across and between countries. We also know that, especially in the first wave, there were a lot of changes in terms of access to community-based programs and to harm reduction services. Many of them had shortages or no access to PPE, and so were really limited in what they could provide to people. And those services are providing really important important supports to people in these communities. And so by having less access, we know that there were less safe spaces for people to use drugs. And what we see in the people who died in the early parts of the pandemic, they were about 3/4 of them alone at time of death, and they were less likely to have resuscitation attempts or naloxone administration. So, that is likely due to the impacts of physical distancing that are leaving people to have to use drugs alone and not be able to use them in the safe spaces they're used to.
So what do you think needs to be done to stop this trend?
I think there are many things. We need to, really rapidly ramp up access to a number of different supports for people. We need access to harm reduction services across the province, not just in the large urban centers, but across all of Ontario. We need to think about safer supplies of drugs for people so that they're not reliant on the toxic supply that currently exists. And we need to think about how to integrate these into all different spaces where people might be, including places like the COVID isolation hotels or supportive housing or shelters that are being set up for people. Because while people are moving between locations, they really need to make sure that they continue to have access to these life-saving services.
Any reason why you think that younger men are more impacted by this?
We don't know exactly. This is a trend that we have seen for quite some time, that fatal overdoses are occurring among younger people, and in particular, younger men. It's hard to say exactly what may be driving that, but I think what it tells us is that there are parts of the population that are being impacted even more than others. So how can we speak with people within these communities to understand what these factors are and engage with them to identify what they need to get some support in this really challenging time for everybody?
I see. All right. Dr. Tara Gomes, researcher at St. Michael's Hospital, thank you for your time.
Thanks for having me.